It goes without saying, but a BAL sample is not the same as a plasma specimen. The lungs are not a sterile site, and the sample can be influenced by airway colonization, contamination by oral flora, where the bronchoscope is wedged, and bronchoscopic technique, including total volume of BAL fluid instilled and collected. So with an extremely sensitive method like metagenomic sequencing, it is not surprising that some results are polymicrobial. As BAL is a qualitative test that does not report MPHN of cell-free DNA, the interpretation of BAL MCF DNA samples require a holistic assessment of the patient, the sample quality, and the clinical question. It can be important to consider all of the following, including who is the host? What is the syndrome? What did imaging show? Is the patient immunocompromised or immunocompetent? What antimicrobials was the patient already receiving? What did the rest of the BAL studies look like? Was there evidence that this was a good alveolar wash, or did the cytology and cell count suggest that it was heavily influenced by the bronchioles or upper airway? Always assessing the additional tests such as gram stain, culture, fungal studies, galactomannan, cytology, cell count, and diff, and whether that there's evidence of inflammation in your BAL sample will also aid in MCF DNA interpretation. In addition, the report categorization will help with interpretation, but does not replace clinical judgment. For example, the detection of a mold, Nocardia, pneumocystis, or another opportunistic pathogen in an immunocompromised host means something markedly different than the detection of these organisms that may be more consistent with colonization or upper airway commensals in an otherwise healthy patient. I did want to share some data regarding our BAL detections to date. Thus far, around 32% of samples analyzed have had no detections. Among samples with any microbial detection, 60% detect between 1 and 3 organisms, while 39% detect 4 or more organisms. While these numbers represent all comers, they're meant to provide some useful context as to the extent of polymicrobial detections seen to date with BAL testing.